Self-harm. Self-harm occurs when someone hurts themselves as a way of dealing with very difficult feelings, painful memories, or overwhelming situations and experiences. Sometimes someone may try to seriously hurt themselves in order to commit suicide, but that usually has a different motivation. The other form of self-harm you might see, or one of the other forms, is, for example, an eating disorder where someone is again trying to harm themselves, slightly different, slightly more complex approach, but again, possibly trying to deal with another feeling or situation. So people that self-harm may feel a short-term sense of relief, but the cause of distress will not have gone away. So different ways that people might self-harm. They might cut or scratch or burn their skin. They might bang their head against things, punch, slap, pinch or hit themselves, pick at scabs so that they don't heal properly. They might misuse alcohol or drugs or overdose. They can, as I said before, starve themselves, make them sick or use laxatives, so a form of eating disorder. Excessively exercise, pull their hair out or poison themselves with medication or chemicals. But the idea is to inflict some sort of pain which gives them that release. It's a very complex set of feelings concerned with punishing and guilt and all sorts of things going on, which they may not fully understand either. So signs that somebody may be self-harming are things like unexplained cuts and bruises, marks like cigarette burns on their wrists, arms, thighs, chest or stomach. Covering up all time, so even in hot weather they may always be covered. Now that might be because they've got severe eczema or some other skin disorder, or maybe because they're prone to sunburn, or it might not. Signs of low self-esteem, putting themselves down, maybe avoiding social events and social contact and being a bit withdrawn, and possible signs of depression as well. But also being prone to frequent accidents. So be aware, some people are accident prone, but could it be something else? So without prying, it's about caring and understanding and trying to help if there is a problem. So if you are trying to help, just think this is a particularly sensitive issue. They are likely to be secretive about it. They're likely to deny it. They may be quite hostile and upset at you broaching it and approaching. So be aware to be rebutted, and be ready to stand back. It's up to them. If they don't want to talk to you about it, that is up to them. But make sure that the door remains open so that you can help them in the future and they know that you care and that you understand. Encourage them to talk to family and friends if that is a more appropriate first step than speaking to you. And explain that the GP will be a very good port of contact as well. Check for any life-threatening injuries and give first aid, practical first aid if necessary, with their permission. And non-judgmentally listen to what they have to say. This is really important. This is their moment to explain why they may be doing it, if they know why they may be doing it, and to get your help. And reassure them that, they're doing the right thing telling you, and you can get them and help them get some help, and then they will feel better. So it's a positive journey. And help them to be in control of their decisions as well. So make a plan between you as to how you can move forward with this.